Virginia State Senator Creigh Deeds remains in good condition in a Charlottesville hospital after police say his son, Gus, stabbed him on Tuesday. Afterwards, Gus Deeds shot and killed himself.
An investigation is underway into why Gus Deeds was released from emergency custody the day before the violence. The case is also raising new questions about issues with the mental health system. Northern Virginia Bureau Chief Jeff Goldberg is live at Prince William County Hospital with a closer look. Jeff.
Well, Gordon, the past few days we've heard conflicting reports as to whether or not hospital beds were available for Gus Deeds at treatment facilities on Monday. State investigators will be asking the big questions. If beds were available, why were they not used? And if they were not available, why not? At emergency rooms, police stations, and treatment facilities across Northern Virginia, the case of Gus Deeds is all too familiar. When reports began surfacing that 24-year-old Gus Deeds could not be held in a mental health facility on Monday due to an alleged shortage of beds in Western Virginia, Rita Romano had one thought.
Thank God it didn't happen here.
Romano is the Emergency Services Director in Prince William County, which gets help for people dealing with mental health issues. She says finding beds for patients under emergency court order is a constant struggle, especially in the mandated 4 to 6 hour time frame. Last year alone, 245 people in Northern Virginia had to be sent to other parts of the state.
Time is of the essence, and we always worry that we're not going to be able to find a bed in time.
After Virginia Tech, funding increased significantly for the mental health system in Virginia. Now, after Gus Deeds, advocates say money is still the biggest challenge to treating patients, some of whom need immediate help, like Deeds.
It's amazing how many people have these thoughts or ideas of doing these things, and actually I'm surprised it doesn't happen more often.
Treatment can be uniquely tough in rural areas like Bath County. There's less money, greater distance between facilities, which often leads to more waiting.
We know that the course of a mental illness can be affected positively if you can intervene early on. So it's a major problem.
Sally Morgan there saying that sometimes the wait for treatment in rural Virginia can be up to 4 months. Now back to the investigation. It is common and can happen from time to time that hospital beds are available at facilities, but they cannot accept a specific patient for one reason or another. State investigators will likely be looking at whether or not that was relevant in the case of Gus Deeds. Live in Manassas, Jeff Goldberg, ABC 7 News.